And now we're going to start a question and answer session. We have some time. So I'll pass it to Shantala Ahania, who's going to be our moderator today for Q&A. And if you have any questions, please put them in the chat or come off mute to ask. Take it away, Shantala.
Thank you, Sophie. Thank you, Aurora, for a great presentation. I think you covered the first question came up on the language, Spanish version. So hopefully we'll be able to provide that sooner. And there was other requests from last few sessions on Vietnamese and other languages. Hopefully that will happen in 2024, hopefully. Aurora, this question for you. We talked about the personal item, not to keep a personal item on the cart. Is that okay, since you know the weather is so hot? Is it okay to keep the water bottle?
Great question. No, so the answer is no. We recommend that no personal items should be placed on their cleaning cart. We worry about safety, and I understand this is also a California OSHA regulation. Can you elaborate on that, Shantala?
Yes, I think it's for the employee exposure, for any exposure to chemicals, right? So then the drinks or the food are on the cart. So safety for the employees, whether it is on the cart, whether it is the nursing station, we should not expose any food and drinks to chemicals. So that's a safety issue. With that, I think during yesterday's session, there was a question. Is it okay for EVS staff to keep their sweater or a jacket in the closet?
That was another great question. And the answer is no. No personal items should be stored in the closet. And we know because, we have a lot of chemicals, and, it's for the safety of the staff. Do you want to add anything else, Shantala?
No, I think you covered it. So it's more of a safety issue. So exposure to chemicals, and they will be wearing that. So we don't want them with the safety issue. I think the one question we got today, and then since I did not see many questions coming up, so we will bring some of the questions asked from our previous 3 sessions. So the first question for today was, when disinfecting floors using a bleach solution, the bleach states rinse after having the contact time. So there are twofold questions. How exactly would you rinse the floor? Is it good practice to go back into the room once the floor have been mopped with bleach solution? So the question is, they're asking Aurora, after they use the bleach solution to clean the floor, according to the bottle on the container, it says rinse it. So the question is, can they go back and then should they rinse the floor after the floor has been cleaned?
Great question. I'm not sure. I know they have to look at the manufacturer's instructions for you, so you will have to follow that very closely, because bleach comes in different concentrations. So you want to make sure that the bleach that you're using at your facility, that you know that contact time, and if it needs to be diluted, just follow the exact instructions that they give you. So I'm not sure if I'm answering the question, but regarding rinsing, and if the contact time for that disinfectant is 10 minutes, so obviously you do have to go back and re-wet it again and make sure that that surface is kept wet, for that exactly 10 minutes. So do you want to add anything else, Shantala?
I think there is a lot of many practices is they usually do once they do the floor cleaning, they don't go back to rinse it. It's because many of them are using the neutral cleaner. So neutral cleaner doesn't require them to go back and re-clean the floor. but bleach product has, they do have, it does say rinse it after you meet the required contact time, whether it is 5 minutes or a 10-minute. So I think it's more of because of the corrosiveness, bleach leaves you the layers, and then it could be, it can create a corrosiveness for the flooring. So work with your the vendor to see whether that is needed, because so then you're going back to clean. It's a double duty, right? So you have to go back. So yes, the product will say that, but when can you do it? So it's how often is it? It's only the reason is more of a corrosiveness, but work with your vendor to see if that product requires, if the bleach product requires you to rinse it. If you have any, so we can always reach out to us. We will bring it back. So I know a couple of bleach vendors. We will reach out to them and then get that clarification from them we'll bring it back to our office hour. So it's a great question. And I think it's, since we have a few more time, I don't see any other questions. Okay. Recommended, I think one of the recommendation to use a quad. Yes, you can use a quad. I think it's most probably in some of the facility. I'm assuming that this was an isolation room and they're using the bleach to clean the room, including the floor. That might be a situation, but we'll get the clarification directly from a few of those manufacturers. And I think since we have some time, Aurora, I'm going to go back and ask a couple of questions which was addressed during yesterday's session. There was regarding the microfiber mop. What is your recommendation between cotton towels versus microfiber mops or microfiber towels?
Yes, that is a great question. We do recommend the microfiber because it will be able to absorb more of the dirt in the surfaces and germs, obviously, but it also helps with the disinfectant that you're using, so it helps absorb more. So that's what we recommend. Do you want to add anything else, Shantala, to that?
I think sorry. I think one of the things which we learned is regarding the when you're using the quads, right, Aurora? So you addressed it right. So one of the question came up on if you're using the quartz product, so then how it affects the when you soak all the towels, and especially the cotton towels, it affects the integrity of the chemical. And do you want to talk about a little bit on that? So how can they, if they're using the quads, how to make sure that they can still have the integrity of the chemical, or maintain the chemical integrity?
I believe for that is like if you're using the quad, you're correct. The microfiber does have some effects with that. So the recommendation will be, instead of soaking all of the microfiber cloths, you would use like a pour bottle and just kind of like pour on the microfiber itself, and that will help to so it doesn't affect the integrity of the chemical or the disinfectant that you're trying to use, so it can do its job.
Thank you. I think I don't see. Okay, so the question is it recommended to use different color towels for different area? Example, yellow for restroom, blue for patient room. So they're asking a question. So can they, it's almost like a color coding it, right? So this is for the bathroom and this is for the restroom. So it's up to, what do you think, Aurora?
Well, it's definitely up to the facility and to find out what works best for them. You know, if that is something that the whole facility be on board and agree to, yes, let's use this color for this to clean this area, and then this different color for that particular area. But you just always have to make sure that you involve the residents, that they know, that they are aware that you're using different colors, because sometimes they'll see, oh, she's using this color, so that means, you know, she's using the same cloth. So make sure you communicate very well with that. But it would depend on the facility. Is that correct, Shantala?
Yes, there is no requirement. There is no recommendation that you had to use the different colors. Again, so like it's up to the facility, and then there are some facilities who have used it for. Some of them go for the yellow for the isolation rooms only, and then this one for this. But it's not required. But it's up to the individual facilities. I think. There was another question, which toilet brush. So it came up on our first session regarding whether can they keep the toilet brush in the resident room, or do you recommend them to keep it in the cart? What's your recommendation?
It depends. It depends. If you have a resident in isolation, you know, you want to make sure that you're using one toilet brush specifically for that resident. But I think you can also, we don't recommend have you carrying them around, because, you know, then you're going to be doing cross-contamination. But what else would you recommend, Shantala?
I think it says you covered most of it, Aurora. I think it all depends upon the facility. What is your risk factor? What is your resident population, right? So keep it in the toilet brush in the resident bathroom. So is that resident has dementia, or is that patient has some other who is a non-compliant resident who doesn't like their roommate? We don't know. It can be used as a weapon, right? So then sometimes, or they can sometimes we have seen the residents are misuse that. So you really need to look at what patient population you have in your building, and can you keep it? There is no regulation whether you can or you should not. So it's a licensing. When the licensing comes to your facility, when they look at it, so they'll question you, but you can always say, if there is no issues with your safety, it's not an issue, not a problem, or not a citation issue. But it always, when it comes to, it becomes, you have kept a toilet brush in a dementia patient room, then it becomes an issue. So we have seen facilities where in subacute unit, they have kept the toilet brush. It's up to you, up to the facility to do the risk assessment. And I think that's for so far. There are a couple of few questions which was asked during the last 3 sessions that we are going to bring it to you with a more clarification and guidance on during our office hours. So I will pass it back to Sophie.
Perfect. Yay. Well, thank you for a wonderful discussion, Shantala and Aurora, and for all your great questions, everybody.